Hello, my name is Ashley Bachman, and today I will be talking about diabetes, a public health issue, for Dr. Craig Winkelmen at California State University, Northridge. Let me first begin by explaining what diabetes is. Diabetes is a chronic disease that develops when the body cannot process food correctly. Insulin, which is a hormone created in the pancreas, is what breaks down our food and turns that food into our energy. When our bodies aren't producing enough of their insulin, that's when diabetes becomes a health issue. There are two main types of diabetes. The first, type 1, more common in adolescents, is also known as childhood onset diabetes. It is the body's lack to produce insulin, and the pancreas of yours isn't working as well as it should be. Type 1 diabetics have multiple types of insulin that have to be injected throughout the day to regulate their blood glucose levels, while type 2 diabetes is mainly caused by obesity, also known as adult onset diabetes. Type 2 diabetes is usually developed in people over the age of 18. Type 2 diabetics have a different style of medication, as many type 2 diabetics take diabetes pills rather than an injection, but most cases of type 2 diabetes develops where a single injection is required at the end of the night. Now, is diabetes a public health issue? I would say 100% yes. According to the National Diabetes Statistic Report of 2020, 34.2 million Americans have diabetes. That's 1 in every 10 people. And 88 million Americans have prediabetes, which is 1 in every 3 people. The report also shows that between the years of 2004 and 2018, the use rate of type 1 and type 2 diabetes has been on a constant increase rate, which means more and more kids are getting diagnosed per year with type 1 and type 2 diabetes. Now, who is the group of people that is most affected by diabetes? Well, coming out first, we have American Indians at 15.9%. Second, we have African Americans at 13.2%. And finishing our top 3 is Hispanics at 12.8%. These are everybody who's over the age of 20. And in 2020, the new cases of diabetes, out of the new cases, there were 15% that were smokers, 89% that were overweight or obese, and 38% that had no physical regimen. Many adults are unaware of having prediabetes, which is why there are so many levels getting higher of actual type 1 and type 2 diabetes. What are the risk factors? Risk factors are if you are overweight or obese, if you are closely related to a family member who has diabetes. For example, my father is a type 2 diabetic, and me and my sisters and I have to get our blood glucose levels checked pretty often. If you live less than an active lifestyle, if you've had diabetes while pregnant, also known as gestational diabetes, you are more prone to developing type 1 or type 2 diabetes. What are the health impacts that diabetes has? Well, it can make other chronic diseases easier for the body to contract. For example, heart disease can damage the kidneys and lead to kidney failure. Diabetes paired with smoking increases the chance of a stroke. Diabetes make wounds heal slower, and diabetes can also develop into nerve damage. That's for your feet, increasing in the probability of open wounds / sores, and the feet can get infected, which might require an amputation. Diabetes is also a cause of global blindness at 2.6%. As I stated earlier, diabetes is treated with a daily insulin injection or daily diabetes pill. The goal for a diabetic is to make sure that their blood sugar levels are in their target range and that they can maintain these levels also by dieting and maintaining a low sugar, low carb diet, and as well as maintaining an active lifestyle that helps your blood vessels be more open and helps your blood move around more freely. What are prevention tips for diabetes and prediabetes? Well, maintaining a healthy body weight is the first step. Taking a short, brisk walk for 5 days a week for 30 minutes each walk can lower or reduce your risk. And as I stated on the previous slide, watching what you eat and looking at the sugar levels in foods, and cutting out all high sugary drinks, such as sodas and energy drinks. Also maintaining a healthy gut by having a high fiber diet can help prevent diabetes. My recommendations are if you are obese or overweight, losing 2% of your body weight reduces the risk of diabetes up to 40%. So if someone is 200 pounds, losing 10 to 14 pounds can prevent diabetes. I also believe that we should teach at a younger age proper dieting tips and how to read the back of labels for high processed sugars, high fats, and everything that goes along with dieting. I also believe that we should include more sports and more physical activity at a young age. And I also believe that we should have a regimen throughout the day for when we're eating and drinking and make sure our glucose levels are all maintained. And finally, here are my references. Once again, my name is Ashley Bachman, and I thank you for coming with me to learn about diabetes.